Michigan Stroke Network evolved out of an understanding that the hospital had just been certified as the first primary stroke center in the state of Michigan, but that there was a demand for the high quality of service treating the stroke patients in a broader community than the hospital actually served at the local level. The real challenge was, how do you get high quality, specialized care out to rural communities in a rapid time frame? What we were able to come upon was telemedicine, the use of telecommunication equipment and strategies to project medical manpower into communities that would never be served by that kind of manpower on a local level.
I was riding around the park, couldn't focus, I was tired, got off my bike, and that was it.
52-year-old David Miller knew something was wrong when he had trouble getting through his usual lunchtime bike ride.
Mr. Miller was experiencing transient ischemic attacks, or TIAs, we call them, mini strokes. He didn't know it, but he was in a lot of trouble.
Stroke essentially is a condition caused by disruption of blood supply to the brain. And when blood supply is disrupted, the brain cells start dying almost immediately. And it is very important that we reverse the disruption of blood supply and restore blood supply back to the brain so the brain cells stop dying or start recovering.
Fortunately for David and his family, his local hospital is part of the Michigan Stroke Network. Despite its remote rural location, he received timely diagnosis and treatment there from a highly trained specialist through the use of an innovative robotic communication system.
The purpose of the Michigan Stroke Network is to bring advanced, comprehensive level stroke care to each and every individual in the state of Michigan. Telemedicine is a robotic technology that helps us achieve that in a very rapid manner.
We have been able to make a big change in the concept of providing care for our patients. With telemedicine, the advantage has been that I can be anywhere in the world and have a laptop with me, be able to go on the internet and examine a patient with the telepresence equipments that are available within the network and give good outcomes to these patients.
Getting expert call panel coverage to emergency rooms is a growing challenge for hospitals throughout the nation.
We project a shortage of specialty physicians. Technology is the solution. This is one of those technologies.
This gap in healthcare is particularly acute when it comes to stroke due to the narrow time window for proper diagnosis and care. Stroke is the third leading cause of death and the #1 leading cause of major disability. A call to 911 soon brought the Miller family to the local emergency department in Port Huron. There, David's emergency physician began assessment and placed a request for a remote presence consultation with an MSN stroke neurologist at St. Joseph Mercy Oakland Hospital in Pontiac, more than 50 miles away. Within minutes, the on-call neurologist in Pontiac connected remotely via remote presence to the Port Huron ED.
It's easy. 3 clicks and I'm connected to the emergency department at Port Huron. It's like being there. Within seconds, I forget I'm in the next county.
Remote presence consultations mean that patients get the care they need when they need it.
Time of response between the call and seeing the patient is about 3 minutes. And if these patients have to get IV TPA, which is the clot-busting medication, we are able to give it below the national metric of 1 hour for these patients.
Remote presence system offers unsurpassed mobility, reliability, visual and auditory acuity.
I never thought be assisted in caring for a patient with a robot. Technology is advancing where we can get the robot to examine the patient's pupils and tell if there's a problem. So it's very gratifying.
Utilizing this technology is a great convenience for the patient. They do not have to travel sometimes hundreds of miles to receive specialty care. They can do it right in their originating physician's office at the point of service. It creates convenience, especially for patients who do not travel well.
We can treat 70 to 80% of the patients who have stroke in their local community, where historically every one of these patients would have been sent to a tertiary center for diagnosis or evaluation. We do that evaluation in the local environment.
Utilizing the stroke network, or now the Michigan Specialty Network, we're partnering with these hospitals to provide comprehensive care in a quality manner with specialists that aren't currently present within their communities. This technology is not limited to one specific application. And any services that we offer here at the originating hospital site through telemedicine, we can provide those type of services in remote locations throughout the state. That can include urology, dermatology, rheumatology. Many of those services are available for that type of remote access.
The partnership with Wayne State is an exciting one for us in that Wayne State had a panel of board-certified stroke specialty neurologists, and we had a network that required that level of expertise. What we've been able to construct is a university-based panel of physicians who serve our stroke patients through the stroke network and at the institution for the more interventional level of care. The other thing that it does is ensure that we follow one of our basic tenets, and that's to ensure the viability and the stability of local health care.
Today, David continues rehabilitation from his stroke.
Go on, guys! About 25 years ago, my dad had a massive stroke after his surgery, and they wrote him off at that time. I feel very blessed that this has turned out so well for me.